My name is Dr. Tova Goldfein. This is TMS Roundtable Global, and I stream other times in the month on TMS Roundtable Israel. This was a creation of mine in response to COVID because I felt like the anxiety level of the world was going up. And that means people were going to start to have some neuroplastic symptoms plus. Enough about COVID. So here we are 3 years later, this last March. Rose and I have about close to 170 broadcasts on the TMS Roundtable Global, and there's about 90 broadcasts on TMS Roundtable Israel. And I am blessed, one blessed woman, to be able to be a conduit to bring people to talk about healing, self-healing, among other things. So tonight, I'm very happy. The last few weeks, I've been very excited about the same topic, but a particular way in, way out, as Alan Gordon would say, of getting out of chronic pain using specific mind-body methods like neuroplasticity. So everyone knows I'm here in Israel, living and working here, originally from Philadelphia. And many times in the global show, I want to bring my Israeli colleagues. So I met Ayelet. I want to just bring up her. I met Ayelet not long ago, a few weeks ago, maybe like 2 months ago.
Yeah.
We met with Dr. David Schechter, who came to Israel. Yeah, which is another
very special event
story. So Ayelet is living and working here in Israel with her family. You're originally from South Africa?
No. I'm born Israeli.
Aha, but you have this interesting...
I have an English accent.
Aha.
Which kind of trades off depending who I'm speaking to.
Okay.
And that's thanks to my parents who made Aliyah shortly before I was born, spoke a lot of English with me.
Wow, yes. Smart people.
Born a Hebrew speaker from age 3.
Yeah, I didn't realize that. I don't know why I thought South Africa. So, and thank you so much for practicing your English. And if there's anyone out there who's listening who wants to translate to Hebrew, we're happy to do it. Ani lomedet ivrit. Ayelet is fluent in Hebrew, but we'll be speaking English. But please, tell me through the Facebook feed if you need anything spoken in Hebrew. We're happy to translate. We're happy to be bilingual. So what was attracted me to Ayelet was, first of all, she's a physical therapist. She has a master's in physical therapy. So it's a very, medical program. And we all know lots of physical therapists, myself as a chiropractor, and it's a wonderful, wonderful profession. It's like a hat that you wear many hats for the entire body. But what attracted me to Ayelet was her interest and her study over many, many years in mind-body methods. So the first question I want to ask you, Ayelet, and I'd love you to talk, like I always say, like, can you give your story from like soup to nuts? Like, can you tell the details of what brought you to wanting to be in the health field, which is an amazing blessing, and then what moved you to thinking more mind, body, or goof nefesh, or more what I think is the truth about health, but what brought you from more like a medical model to more like a holistic or integrative model? Can you start sharing, and I won't interrupt?
Well, first of all, thank you, Sheba, for having me on. It's a great pleasure. It's a great question. I think that I have to say I didn't know what I wanted to be when I grew up. I was at that stage between study, trying to decide what I was going to study. And I went out to London because my grandfather had to have a leg surgery removed. He basically lost a leg when an artery broke in one of his legs, and he basically went unconscious. Didn't know that he was going to have the surgery, and when he woke up, I was by his bedside when he got the news that he'd had an amputation, and that was a difficult recovery. But I was there to see the physical therapists by his bed give him energy and life back and meaning and understanding that he can find his own way back to strength.
Wow.
He was a young grandfather at that point.
How old were you when this experience happened?
I was 19. I was just after my 2 years of service in Israel, going on 20 and making my decisions. So I came back from that trip deciding I wanted to be a physical therapist, and started studies a year later. And I really loved studying physical therapy and got to Tel Aviv Hospital to do my, to my first job in rehab, and came very excited to help, and found that I only had some of what I needed. I saw a lot of patients who were needing of assistance, but also had a lot of pain. And there was so much that I could do for their bodies, which I found that I could help them, progress and get their muscles back to work and slowly gain strength, but they were still suffering a lot. And slowly I worked more and more with those patients that were more pain inflicted, and less body inflicted, in an obvious way. And I started looking for what would help them more. And that's when I started working in pain, in a pain rehabilitation unit, which was specializing in chronic pain, in a multidisciplinary team with Dr. Adahan, who made Aliyah recently before, Dr. Moshe Adahan from Israel.
I think I've heard of him.
The Canadian unit, who was doing similar things in Canada, made Aliyah and brought the idea with him to Tel Aviv.
Which idea was this?
The idea was to have a multidisciplinary team, which was all specializing for chronic pain. And
at that point, did you hear anything about the brain?
I'd done neurobiology a little bit during my studies at a very, very plain level. I found it fascinating, but there seemed to be very little that I could do in my actual work which correlated with what I had studied.
Right.
And that's really where I started looking, I think, for answers. I started understanding that you need to be able to take that understanding of neuroplasticity of the brain. I started reading about neuroplasticity and healing, and that's what really brought me to Explain Pain with David Butler. And
Explain Pain is the work of Laura Mosley, which a lot of us know about. He's not so much in the field as much as in research, but everyone knows his famous story about the snake bite. And so that's amazing. So you gravitated towards in Australia, and then the book is translated.
He'd come to Israel for 3 days, and I went to his course.
Oh, wow.
And then I found, okay, this is what I can do with my patients. This is what I can help them. This is what's going to be, what's going to be the missing link. So I started.
What did you learn from him? Like, what you just thought? It's like understanding the
It's a lot of neuroscience, and then understanding how fear is what drives a lot of pain, and how when you explain the neuroscience behind pain and take away some of that fear, then you can do a lot.
We call it, like in my world, which is also your world, but now I didn't learn this even till a few years ago from, Schrubener, who you take in the course, but more this Dr. David Hanscom. He calls it threat safety physiology.
So in Explain Pain, they speak about safe in me rather than scared in me, and I used to really take what was causing the patient to be in an afraid position, what was in safe in me, and how do we bring more things into the safe in me place.
Yeah.
And it was eye-opening, and it did start making changes that I hadn't seen otherwise, with all the regular techniques and with doing a lot of manipulations and massages and hot and cold therapy and whatever patients wanted for me. But I also would explain and talk to them over their heads and give them all of this. And then about 3 years ago, I started reading Sano's books and understanding that there's an emotional issue that's deeper than all of that, and that carries another part of the puzzle. And that's what brought me to Shubina. That's what brought me to doing Shubina's course 2 years ago. And it's all like giving me a whole bunch of great things to do with my patients. I'll let you give me my next question.
Okay. So 2 things. One is, even Dr. Schubiner will say, well, when we realize that many of these people are neuroplastic or have pain that's just becomes a pathway, a habit, or a circuit, we need to train them. Even if we know we've diagnosed that's their condition, many people just will not get it. They will not be able to get better. The fear is too great. So, Rose and I lots of times like to talk about those people that are struggling and that are not getting a book cure. And, and I even had on the Hebrew show, we compared a person who had the book cure to a person who was taking years, and even the person taking years was even younger. So it had nothing to do with his personality. So what do you, how do you see that in your practice, the difference of the people in how they're healing, and what do you do with people that you can't heal? I mean, it's so frustrating for us as the health practitioners, because we go home and we have a heavy heart because we know it's in the brain. How do you deal with some of those situations? Maybe you can talk about a case or two where you help them, because it's a journey.
Sure.
I said today to a 70-year-old lady, okay, sit down for a minute. I said, she was like, when am I going to get better? And I'm like, well, let me have a discussion with God and I'll get back to you. And I was like, you need to get better at feeling before you feel better. And I knew it sounds
That's very, very true.
It sounds so. Okay,
so I think that really zones into what I see as the core difference of who I think it's going to be an easy journey for and who less. I would talk about connectivity with themselves, how they're connected to themselves. Meaning there are patients that you can see that they regulate their emotions more easily. Okay, they can go like
regulating emotions. So self-regulating. Would you call regulating emotions, Ayelet, the same thing as self-regulating your nervous system, or it's different?
Yeah, I think I would say that it's very similar, and very often the same people can do more with the nervous system as they can do with emotions. Yes.
Okay.
And I think that it's the same people that small triggers aggravate much more are people that have a much harder time when emotional issues make them jump much further as well. If we're talking about the same correlation.
Right.
I'll speak to maybe a few patients that I saw situations with, but I think about fibromyalgia patient that I've been seeing, who was actually great at emotions. I could tell that she was the rock for her family, and that she was very, very good at not controlling everyone's emotions around her. And that she was good. She was also very, very adept at understanding her own emotions. Like, we kept on everything that she was saying, we kept on kind of bringing back to herself, and she could recognize, and she kept laughing at herself and saying, oh yes, that's what's happening to me. I'm now, my child is feeling upset about the fact that he can't go go the distance medically that he wanted to go, and I'm taking that upon myself, and it's making my own emotions. And we could really trace a lot of that back. And when she made the transition from seeing that to her nerve system, meaning the light in the room was bothering her, and when I said, okay, so now the light's going to be a little bit more, I'm going to turn up the light a little bit, because I have like a very neat little switch where I can turn
a dimmer,
exactly. And it's going to be a little bit more difficult, and I want you to try and feel those same emotions that you were trying to help your son feel when, and it really did click for her. It made a change, and she was able, she still has some fibro issues that we're working through, and it will take time, and I do see recoveries in fibromyalgia, but it's always a long process.
Yeah.
So she seems to now be on her way, and something in understanding that connectivity inside her seems to have helped her with her symptoms as well.
That's amazing. So you really did exposure therapy. You exposed her to the trigger.
Yeah. I do a lot of provocative testing, and then using exposure therapy with my patients according to what I've seen the provocative testing bring up in their symptoms that they're complaining about, right? If a patient comes in with a certain issue, if it's headache, if it's neck pain, if it's back pain, if it's migraines, if it's the fibromyalgia, all different little issues. And if we realize that it's to do with cold or I always look for the triggers, and we try and figure out through provocative testing. Could be touch, and it could be imagination, it could be
what's
movement.
Provocative? Explain that.
Provocative testing is from Shubina's course.
Yeah.
It means that you go for you look for the trigger which has created the neurological pathway that's creating the symptom. And if a person is talking about sensitivity to cold and the air conditioning, so you want to be in a situation where you can turn it on. The person can be calm, and he knows that you're going to turn on the air conditioning, and you can help him feel stronger and better and emotionally in a better place before dealing with the emotion or the pain or the reaction that comes on once you turn on the air conditioning.
Right.
And then you can calm yourself down accordingly. Or getting up from a chair, right? Like sometimes the actual movement is what I'm afraid of, so I can imagine the movement and feel all the pain. Then I know that it's the actual imagination of the movement, not the movement itself, which is causing my fear. And I can interact there and relearn and use my nervous system to understand this movement better and to.
Okay, so for example, this person, every time they get up, they have pain. It's a conditioned response.
Yes.
And, okay, so go through this, because I love talking about this, especially I remember Shubiner in the course I took, which was different than yours, but it's all the same, but it was the year before. And he talked about it. He showed a patient who couldn't deal with cold, could not deal with cold. And she had her jaw broken, and there was a trauma. And so here is years later, she can't even have the window open. So he spoke to her, and then he had her put an ice pack on her jaw, and she was safe. So, but what you just said was, before this person put the ice pack on her jaw, Dr. Shubiner was letting her know that, ice is safe. There's nothing wrong with ice on your jaw, nothing wrong with wind on your jaw. So go through what you did.
What I think Dr. Shubiner do as well is imagine the wind on the jaw first.
Okay, I like this.
And by imagining it, you see that it provokes the pain, meaning which gives you an opportunity to say, "Aha, it's not actually cold."
Like if she thought about it and felt pain in her jaw, it would show her that it's just the thought that's causing it.
But it's just the thought process. It's the association. It's not the actual. It's not the actual cold.
I forgot that term he used.
And therefore, and then it's something inside herself that she can change, because she can change the thought. And then you try and come into that thought process and go through it again. And maybe not. You start with doing it by imagining, and then you can bring the ice in and actually do it with the actual trigger, or with getting up from the chair.
So, for example, the person has, I'm just trying to get it clear, because sometimes I want to break it down for the listeners. So I know when I get up, I'm going to have pain. It happens every time. And even if I say to them, well, it's a conditioned response, I don't think what you're doing is even deeper. It's like, yes, they're expecting it. So you're saying they're sitting down and they're thinking about the pain when they get up. And if
they're sitting down and imagining the process of getting up, and enough that the brain goes through the stages that it creates the association, if it's a strong enough association, which it isn't always. So you have to look for what is the right triggers. But if it's a strong association, and the brain has really brought itself to fear standing, then just imagining the movement will create the same pain, or create a part of the pain. Right. And then you can you know where to zoom in and start working.
What about, Ayelet, if we say to the person, imagine that you're getting up and you're having this sensation, but it's not dangerous. Isn't that another sort of way? Is it the same thing that you're saying? Just imagine that you're getting up and having normal sensations. They're not hurting you. You just have you have a hyper reaction. Your dial's turned up to 10. So as you get up and experience these sensations, let's just become less sensitive. Oh, there's my sensations, but I can walk. It's not dangerous.
Right. That's exactly what you do.
Yeah. Okay.
Yeah. That's the process.
Okay. So, because some people, I talk to some people and they're like, you're being too abstract, Doc. And I'm like, because for some people, it's like they want to get it. They're smart people. They want to get it. But they're so in their, it's trauma.
It's not a process you can wish yourself. And it's not like sometimes she says, okay, so I'll just think differently. But no, we have to build the thought, and you have to progressing those nerve systems, and
And it's also, look, the person is talking to you, like this woman was talking to Dr. Schubiner, and she had, fear around the cold. And here he had to also, like, they're not going to just let go of the fear. The fear's, sort of sitting right there. And yeah, I'm going to get up and do this for you, Doc, and get up off the chair, but my fear. So I think that's part of the safety threat physiology, and partly the evidence, like what you were just talking about, was the evidence is it's you can even create the pain without moving.
Right. So, but before we start, actually a good point, before we start getting into any kind of situation where we're provoking the pain, I always give the patient a few, we talk about the sympathetic, parasympathetic, fight and flight, and the nerve system, and through speaking about that, I always give them a few ways in which they can control getting back to safety.
Okay.
First, you learn how to get back to safety. You learn how to use your diaphragm breathing. You understand where that safe place is, what I can use to get myself there, even if I'm now in some pain or, having some kind of conflict or fear. And then you can start provoking and getting into a place where you're challenging yourself into a more difficult situation and working on getting back.
Mm-hmm. So now you're talking about something very, very, very important, which is this fear-pain cycle, which they talk a lot about in the movie Pain Brain. So we know as health professionals the power of the breath, the anchor of the breath, and how that can, bring down the anxiety and whether it's humming or breathing deeply, a diaphragmatic breath, which activates the vagus nerve. And yet their dials turned up to 10, so it's like, and then we talk about, and then, I learned from Alan Gordon, then we talk about, well, then then just deal with the fear. Like, go put an ice pack on, put heat on, take an Advil, whatever it takes, like these avoidance behaviors, they call it in the Alan Gordon work. So go ahead, smoke a cigarette.
Is avoidance behavior. To me, avoidance behavior is, I'm afraid of getting in a car, I'm not getting in a car. That's okay. I actually think that this is what I call crutches. Okay?
Good name.
If you've broken your ankle, it's not the right choice to not use crutches and have half weight bearing before you do full weight bearing. And therefore, sometimes you will take some medication, and sometimes you will use hot packs, cold packs, whatever helps you. Maybe I'll end every session with a short massage of some kind, because I can see that touch and maybe movement therapy will help this patient. And therefore, I'll combine everything that I know to help with the first stages, until they start feeling that they have more of, I think, hands on the reins, more of how they see themselves maneuvering themselves within their problem.
No, it's a good point. I mean, I it's really, there are people who are in pain 24/7, do have the sensations 24/7. Though I've met some interesting cases, and I know that she was on my show last week, and she's not on the show tonight, and her case is fascinating because it's some autoimmune leg neuropathy, but nothing is wrong with her. There's no damage. It happened after she got the COVID vaccine, and just really had a lot of fear around it. And here's the situation. She gets enormous amount of relief from her symptoms when she's socializing. The symptoms are still there, but much less, and she's completely not in fear. When she's alone, the dial's turned up. So
this is brings me back to a picture from Explain Pain.
Yeah.
That most use a lot, where they have everybody sitting in like a picture of a brain, and everybody's sitting in a room together called, a meeting. Everyone's been called into the pain meeting. And sometimes our main goal is just to get as many of the people in the pain meeting out of the pain meeting into doing something else. And as soon as they want to do, they run back into the pain meeting, and because this is the main thing that's on the table.
Wow.
So sometimes we just need to help them find where else to put themselves in use. And often I use that analogy with my patients.
Yeah, I mean, I'm trying. She's like, help me find a way to be that way with myself. And the fact is, we talked about this, I think, either on the show or before the show, but this particular person is so angry at herself and so doesn't like her body, and she's a beautiful woman. So then we're back to we're more the emotions, possibly trauma, because they say you can't heal a body you hate. And going back to fibromyalgia, like, if I could have more time in my day and open up a fibromyalgia clinic and help fibromyalgia people, like, I want to help all people in chronic pain, and many, many people are suffering from fibromyalgia, and they don't need to. And a lot of those people were on my show, and they have healed it. And I feel really grateful for these case studies, people healing. And I say, you kind of have to love not the fibromyalgia, but to accept this situation. You're not a victim. You can heal. There's, it's kind of like, and some people with fibromyalgia, they don't want to talk about that. They're really angry, and I don't blame them. But this is another part of our work, the emotional part. Or maybe, can you talk a little bit about maybe the trauma, which we know we all have. We're all human. So can you address that a bit?
I think that one of the ways that Shubiner talks about it, he says that the bully in the park, okay, if the bully is coming to, like, what the bully wants from us in the park is he wants to provoke us. And we all know that the best way to deal with a bully is to pretend that it doesn't bother us, that it's not an issue. Pain has all over us in a way that, what do you mean it's not an issue? The only thing I want is the pain to stop. But because the only thing I want is the pain to stop, that becomes our bully. And
say that again. What becomes the bully? Our relationship with the pain.
Our relationship with the pain. We are now dependent on the pain stopping. And therefore, the bully has us in its hold as long as that's what we're really worried about. Will the pain stop or won't the pain stop? And very often we can only really reach this corner of things starting to change when we can really say to ourselves, okay, the pain will stop, the pain won't stop. I'm going to do the same thing tomorrow, whatever happens.
So to be what's the word?
To be oblivious
to not be attached, to not have
whether it's a yes or a no and how it's going all the time. And we often see patients that, are checking in with themselves the whole time. Does it hurt more on this side now? Now has it changed to the other side where it is? And this is the problem with that symptom, that as soon as we're checking in, we're bringing up the volume, and we're
spotlight.
Tendency on that yes or no is greater, and then we're fighting a losing battle with ourselves. Yeah.
So
and that's often the hardest. I think one of the hardest things to overcome.
And yet, I think if we can all accept that we have health anxieties, which is not a bad thing, we can live with health anxiety. I personally have a health anxiety. I grew up with a mother who had MS, and it rearranged the direction of my entire life, professionally and personally. And I see that I have various health, like spotlight or not. And I might be extreme about something or not extreme. I might be detached, and I watch it and I say, well, but I've channeled this to serve me. I've channeled this health anxiety so I don't live in fear. So I have compassion. So I'm not, obsessed, and I'm constantly working with it and keeping balance. And so I understand people, because a lot of our patients have health anxieties, and to accept it. Okay, yes, I have health anxiety. Yes, I had this sensation. Yes, I have this condition. And I think we're back to the personality. We're back to the acceptance. Michael Galinsky wanted to call All the Rage, that movie, he wanted to call it All the Acceptance. But he said it wouldn't sell in the box office, right? So he called it All the Rage, and yet, All the Acceptance. It's such an important tool and an insight for people to calm their nervous system. It's like
why it's acceptance therapy. That's why we have to.
Right.
That's where we're going.
And once they hear that they're not broken, fibromyalgia people, let's go back to that, because I really want people to hear this. Fibromyalgia can heal. This is not a sentence, a label. People are healing, and it is an emotional, psychological, physical, biomechanical method. There is something different in your muscles. There is an imbalance. Can you talk about that? Because you said
I've researched.
Please talk about that.
Fibromyalgia, and my research went into two fields really. The first thing I did was to do with sleep disorder in fibromyalgia. One of the things I put a spotlight on with my patients is sleep. I use CBTI, which I did a course.
What is that?
Behavioral cognitive therapy for sleep.
Oh wow, amazing! I didn't know about that.
Sleep. It's actually seen today as a gold standard for treatment for sleep.
Wow.
And I went seeking it because I saw that out of 100% of my pain patients, 90% have sleeping issues. And fibromyalgia, I can tell you it's 100%.
Wow.
But one of the things that I found in my studies was that there was definitely a very high correlation between how the worsening of the fibromyalgia symptoms and the sleep process and what was going on with
direct
sleep,
relationship
with sleep. Yeah. So it's one of the things I work with my fibro patients a lot. Whether it's just reorganizing those hours of sleep properly into back into the right structures, learning how to get out of a chronically sympathetic system where we're always on edge and always ready for the next fight. You can't fall asleep that way. So we have to get out of that stage and into something more relaxed, and helping patients get to a stage where they can fall asleep.
What do you think? Do you think there's 3 or 4 things that are keeping fibromyalgia people awake? Is it in the nervous system? Is it in the immune system? Is it
in fibromyalgia? It divides between there's 2 main symptoms. There's not falling asleep, okay, which usually is more of a behavioral and tendency, and there's being very, very tired in the morning or feeling tired throughout the day, tshishut, which is fatigue. Sorry, that was the word I needed. Which has a lot to do with the night, but isn't always in full correlation. And often how patients saw their own sleep, meaning when a patient in a sleep diary had a perception of sleeping better, she felt more awake and had less fatigue the next day. Okay. Whether things changed or didn't change, which was very, very interesting. So that was one of my studies with fibromyalgia. The other issue was more about movement disorder. One of the things that we don't really acknowledge much about fibromyalgia is that there is a definite reduction in
balance.
Yeah, we can see a reduction in balance. There's more tendency for falling, and patients have less of a core. Like there's something in the core system which seems to get lose strength, especially after less sleep, and is just less known and looked at in fibromyalgia. Everybody says, okay, so you're just all in pain, whatever. But the movement, working on them with their balance and changing directions, building up the body's feeling of being able to save itself when it thinks it's falling, and movement confidence is critical, and can really make a change in how they feel, and therefore it's one of the things that I work with them on.
Amazing. And what else have you learned about in your fibromyalgia studying, which is amazing? What have you learned that's able to help people, heal themselves or heal them, which your goal I know is with less medication and less, injections? What else are you?
Steps of fibro are very similar to all my other pain patients because it really comes from a very similar area. But first of all, the biggest misconception is that this idea that they're weaker, or that they call it regishut yeter in Hebrew, right? That you're too sensitive, but you're not sensitive. A sensitive nerve system isn't a sensitive person. You're not those tears. So I give them, I give my patients a lot of I spend a lot of time on giving them an idea of how they're strong individuals and how that
sensitive is the new strong. Sensitive is the new strong, by the way.
And how there are a lot of strong, amazing people out there who have fibromyalgia, and fight it every day, and that there is and the sensitivity is something that can be changed. That sensitivity is something that changes every 48 hours in our body. Our nervous system is reorganizing how sensitive
I
we're
love this. I love this.
So every 48 hours, we have a chance of making a change. And we can't jump to 100%. And we don't.
Where did you learn this? This is a fabulous fact.
This is neurosensitivity. This was in a
Wow.
lot of my I think in every single one of the courses we talked about
Wow.
how the
I don't think I'd really heard that. So that's amazing for me.
so when the nerve system remakes itself, it usually happens during REM, during sleep. And
Okay.
it basically sifts through everything that you've done during the day and checks how much have I been in, how much safety have I had, how many, what do I have to lean back on, okay? How do I have, how many safety nets do I have? Which is my energy, which is family, which is my sleep, which is my, is how much food I brought into my body, whether, that nutrition is now stable. So basically, how stable the person is on a whole is a very big part of this decision. And how many times has my system, been shocked? How many times has my alarm system been rang this 48 hours? And slowly, when we get less alarm, or if we're less alarmed by the alarm because we've learned how to regulate.
So we've responded to the alarm and not reacted.
Yeah, exactly. And we've brought ourselves to a better emotion every time that our alarm goes, then we can start, then there's more chance that your body will now respond and create less sensitivity to this area. And then we can slowly build up that sensitivity again, and you'll become more resilient to the same triggers. And fibromyalgia, the only difference in what I see for fibromyalgia and back pain is that back pain is a trigger in one area, and fibromyalgia has a lot of triggers and it's all over the body, and it's happening.
Do you think that? I mean, I think that some fibromyalgia patients might be a little bit insulted by that. I mean, I agree with you, but I don't want people to feel that. I mean, we're on your side. We're not here to say there's nothing wrong with you. There's just fibromyalgia is.
I don't see why it would be insulting to say there is a neurological finding in every one of your nerves, which is different to people around you. And they have found in MRIs, functional MRIs in fibromyalgia, that there is a definite difference in, almost every trigger that you'll do for a fibromyalgia patient, you'll do less trigger and create as much neuroactivity as a normal person will have to do 3 or 4 times that trigger to create the same neuroactivity. It's very, very physical. It's black and white. It's not in your brain. It's not imagined. It's physiological.
But
it's just not something you can see in a regular MRI or in a CT scan.
But the dial is turned up to 10, and they can learn to dial it down. They can learn. That's the good news.
See how, there's amazing tests that have been done showing how someone who is sleep deprived for 2-3 weeks starts creating symptoms similar to fibromyalgia. And if they begin to sleep again, then those symptoms change back. We can really see in a lot of different areas how fibromyalgia is not. It's just so is inside the nerve system, inside the physiological self, and not just an imagined "I'll shake you and it will come out to me."
No, but it's the good news is that people can heal from it. It's not permanent. There's not permanent damage. There's no damage.
Just like neuroplasticity. It's neuroplastic, which means it can change, but it's a learning process. And like everything neurological, it has to be learned by the person itself and by the body itself, and can't be learned passively.
So they have to practice new neural circuits, like neurons that fire together, wire together. They have to practice every day and, have this self-talk and this, I call it the language, and speak to your.
There are the few levels. There are the learning processes that you can do with all the triggers, right? There's the center, which is your overall system of how safe you are in your brain's perception, which has to do with your sleep, getting your emotional issues dealt with because of, whether you have family system or friends and who you have to support you around you. It's movement in general, right? Because if your system, if you've got endorphins during the day pumping through your system, that helps bring the whole sensitivity down. So it's a lot of things together which help you get to that point and start.
So if you were to leave, of course, every client's different, and that's what I think is beautiful about our work. We don't look at fibromyalgia as you have this label. It's like you are this person who has these symptoms. So let's treat the person, not the symptoms. And I know that we agree with that, and we're surrounded by health professionals that are seeing the patient that way. And it's a much, what I call, thorough way to treat someone, and a much better relationship for the patient.
Well, the good news is that the world is going that way, meaning
yes,
all services are becoming customer-centered.
I love it.
I think that healthcare is going to have to be patient-centered. And, everybody else all the doctors that are a little bit further back will fall back. And if, only those who know how to really center everything to their patients' needs and individualize for everyone.
Yeah, and I don't think that we're never bashing doctors, because I believe doctors are doing the best they can. Dr. Schubiner will say every time he got maybe 3 hours of lessons on pain, nothing on nutrition, let alone pain. And so we don't blame I don't ever bash.
Doctors are giving the best advice they know how to give, but most doctors, this is not in their toolbox.
Yeah. Yeah.
And for a doctor, the worst thing is not to have what to give.
Yeah. Yeah, exactly. I always try to, like, can you imagine your doctor having to say, I had to learn that. I had to learn how to say, I don't know, to a patient. It's hard.
It's not only that, it's that a doctor goes into a profession. I think everybody who goes to treat goes to heal, wants to heal.
Yeah.
And therefore will try and bring whatever they can to the table, which might help the person in front of them.
Yeah, it's a really good point. I feel like I have so many questions, but there are some listeners. If anybody wants to ask Ayelet any questions in Hebrew or English, we're here for a few more minutes. I feel like I want to let people know after this recording about what you're talking about, or fibromyalgia, because I saw in your bio that you're involved in a study, and I think that this just presents hope and belief for healing. And I spoke to a group in Israel, hundreds of women with fibromyalgia, and it's so hard for them, Ayelet, to believe that there's a way out, and so I think just more and more I want to just, like, I call it, like, drop some pixie dust on, like, these groups, and just say, this is not just like on the side. This is not just like this is the main game. And again, when the student is ready, the teacher will come. When the student is ready, they won't even need a teacher. So I know part of our work is we cannot bring it to people who don't want it.
This is true.
Yeah. But what would you leave the listeners would you leave a few, please, key maybe insights, or, like I call take-home tools that people could apply? Because we have a lot of knowledge, especially with our world now, but so much of the road is how we apply it and implement it when we're in pain, not on the yoga mat. When we're in the most discomfort is when we get to practice. What would you share on that?
I think I would share that that it's a journey that you need to be brave. It's always looking inside. But I think that if you look for what was the last time, or what helped you get out of your last difficulty, not pain, but look for a time in your life where you were lost, or
you overcame adversity, when you
overcame some kind of obstacle, and understand what it was in yourself that helped you get over it, because you'll find that the same thing can help you get over it again. It'll be the same emotions. And that we build up every day our support systems. Like in every day that you're building up the support system, it'll be 100 times worth it when you need them, when you need to lean back. And that very often giving is one of the strongest ways to start your journey.
So important. So important. Dr. Sarna talks about that. Very important, key, and not something you'd hear in your doctor's office. But, anyone who wants to come to Ayelet or me, we're going to say, so what's going on in your life? And immediately people are going to start to feel better. But, there's a doctor in all of us. And I like to believe there's a therapist in all of us. And we have overcome adversity many times. And that's the person that can meet these symptoms and say, okay, let's see how we're going to overcome this together. Because that's, years ago it was like, let's beat cancer. And now, it's like, let's meet
yourself.
Let's meet cancer. Let's meet autoimmune. Let's meet pain. And, so this show is just more blessings for hope and belief, and a great word you used, courage, and to be brave. And I look forward to working with you in the future. And if anybody wants to contact Ayelet, she's in Israel. Are you doing any Zoom?
I am. I do telemedicine, I do Zoom, and I work in a few pain clinics in Modi.
Great. And you're a mother of three. You're a mother of three children, so I don't know where you're doing all this, but you are.
So if you put a link to my site, you can always contact me through the site or through my cell number.
Wonderful.
Okay.
Let's plan to meet again, because I don't like saying goodbye. I like to say, let's plan to meet again.
Great.
And I'm very excited about the Pain Brain movie, which is really proving some of this research, and it's just a well done movie. And it's just a matter of time before there's more information. And because the science is important, this is important. People need to know the evidence. And the beauty of it is that, it's mind and body. I mean, I'm all for a hot pack. I'm all for a massage. I'm all for, you want to smoke a joint, but let's find out what's the anxiety driving you to want it. Let's just figure it out, There's nothing wrong.
Let's be curious towards ourselves.
Yeah. And so it's a good word, curious. And we're not judging, we're the last people to be judging. I say God's the judge. So anyway, thank you so much. Bless your heart.
Thank you for having me on, Tova.
Family and your husband for giving you up for an hour tonight. And we'll meet again.
Okay, thank you.
God bless.
Good night.